It's really great to see everybody and glad people can join us. My name's Margot Emery, and I have a very great pleasure of being able to introduce this session this afternoon in our final part of the celebration for International Nurses Day, and it's been a fantastic week. I just want to point out a couple of things to people. So we're recording the session, so that's already started, and I hope people are happy with that. Anita's going to be helping in the background with the slides, so thank you very much, Anita. And I'm looking forward to a really, really great session thinking about the future of nursing. So, Anita, if you could start with the slides. So first of all, just to remind colleagues about etiquette around being on this Teams meeting. So if you can, please keep your microphone on mute throughout so that everyone can hear the speakers. I'm sure you're familiar now with the hands up function, which is at the top of your bar. So if you've got a question or you want to say something, please put your hand up and I'll try and pick up on those as quickly as I can. We've also got our chat box function, which is next to the hand icon. And if you've got a question, please could you put the word letter even Q before, or see if it's a comment, and that helps us picking out the comments. And if you have any problems with connectivity, I know that sometimes if there's a lot of people on, connectivity can be difficult. So if you want to turn your camera off, that may help that. Thanks, Anita. Next slide, please. So I'm Margot Emery. I'm Head of Nursing for Community Health Services, and we've got a really great panel this afternoon. So we've got Lizelle and Pretty and Caroline, who are all going to be talking about things that I think are really, really relevant to where we go as a profession in the future. We've got some question and answer time as well, and we'll probably do that in between each speaker if we have time. We'll see how the time goes. And then Anne, as our Director of Nursing, is going to close the meeting and close the week, really. Thanks. So, why are we here? So I know that you'll all know this, but just as a reminder, Florence Nightingale was born on May the 12th, and she's, we regard her as the founder of modern nursing. And actually, May the 12th has been celebrated since 1965, although it's only been in recent years that our first celebrations. So it's really good to be able to celebrate. Of course, we were all set to celebrate big time last year, with 200th birthday being the year of the nurse. But of course, we had to mute our celebrations because of the pandemic. But we decided that this year needs to be really special and really to mark that. And gosh, what a year of the nurse we've had. So yeah, we've had a great week celebrating her birthday. Thanks, Anita. So, I don't know whether Anne wants to read her message out or whether you just want me to do the quote, Anne. It's entirely up to you. You're here,
as I'm here, I'll do it if you don't mind. That's fine. So, I mean, this was really a message from me to everybody across LPT, and the difference that every nurse has made across LPT and how everybody has adapted to working differently. I've been so humbled to see how staff have stepped up throughout the pandemic. And I just wanted to say absolutely a big thank you. And in my closing commentary, I will go into a little bit more detail about what I've seen on my clinical visits this week. Absolutely fascinating and brilliant. The International Council for Nurses has made the theme for this year, the celebration. The theme is about nurses, a voice to lead and a vision for future healthcare. And the Royal College of Nursing are showcasing what this means to be a nurse and how nurses have led the patient care throughout the pandemic, and fundamentally the role that nursing plays in patient safety. So essentially that is what we're celebrating and have been celebrating all week. So thank you, Margot.
Okay, so without further ado, I'm going to introduce Lizelle. Lizelle's going to talk to us about her work in developing clinical academic careers and how we're preparing nurses for the future with our Director of Nursing Fellowship. So over to Lizelle. Thank you.
Thanks, Margot, and thank you for inviting me to do a presentation as part of our International Nurses Day celebrations. As Margot said, I'm Lizelle Bernard, and I'm a heart failure specialist nurse in community health services. To give you a little bit of context about me, I completed my nurse training many moons ago, dare I say in the 90s in South Africa, and I've spent most of my career in cardiovascular nursing. I'm also a final year PhD student at the University of Leicester, and I'm in the last few months of my thesis write-up. As a nurse, I'm passionate about improving patient care and outcomes through research, and my ambition is to develop as a clinical academic, hence my interest and why I'm doing the presentation. So in the next few slides, I would like to share with you the importance of research in patient care and outcomes, explore what a clinical academic is, how we support clinical academics in LPT, and introduce to you the Director of Nursing Fellowships, which is a new development opportunity for our Band 5 nursing workforce. Our patients and service users expect to receive high quality care that is informed by robust evidence. In order for us to provide this evidence base, research plays a vital role, not only in developing and improving patient care, but also to provide the transformative and sustainable healthcare services required to meet the challenge of an older population, often with complex needs. Research is intended to build the scientific foundation for our clinical practice, providing the evidence to support nurses and other healthcare professionals to provide the best and most effective care for the patients and people we serve. Research is not only core to the NHS principles of maintaining the highest standards of excellence and professionalism, but is also recognised as central to the CQC standards and CQC key lines of inquiry. Therefore, to ensure continued improvement in care, we need to embed research and innovation in our routine clinical practice as nurses and AHPs. Nurses, midwives, and allied health professionals make a significant contribution to health and social care research. Their research informs the body of professional knowledge to establish a scientific basis for the care of individuals across the lifespan, from prevention and health promotion to management of patients during illness and recovery and beyond. Clinical academics are nurses, and I know this is for Nurses Day, but I just have to throw in the other healthcare professionals as well. So they are clinical academics are nurses and other healthcare professionals who combines the role of a clinician and a researcher. They question, investigate, research, innovate, and build cultures of evidence-based practice to accelerate improvements in clinical care. They use their research skills and analytical skills to understand clinical problems, develop evidence-based solutions, and implement change impacting on cost saving by reduction in inefficiencies, doing the right thing the first time. Currently, clinical academic career structures are well established in medicine and dentistry, but across the other healthcare professions, only 0.1% of the workforce are clinical academics, and of these, the majority are cited in universities rather than integrated into clinical departments. This separation of research and clinical practice has a number of limitations. It restricts the nature and scope of the research. It can limit the development of research capacity and capability amongst clinical staff, and it reduces the potential impact of research on patient care, experience, and outcomes. Therefore, what we aspire to is for nurses and other healthcare professionals to combine the role of clinician and researcher rather than having to choose between the two. The benefits of clinically active academics means that their research is grounded in day-to-day issues of their patients and service. There are substantial benefits to developing a workforce of nurses, midwives, and AHPs who work as clinical academics. I would like to share with you a couple or so reflections of current clinical academics, what it means to them to be a clinical academic. It's about making a difference. There's no point in doing research that sits on the shelf. It actually has to speak to and improve patient care and outcomes. A clinical academic role is about addressing the problems that emerge from the NHS using research methods. It's a two-way journey to influence issues that emerge from clinical practice. And the last one, the clinical academic approach offers different ways of thinking about problems. It enables us as clinicians to step out and see things from a different perspective. I think what is central to all these interpretations and definitions is that the research that clinical academics pursue is grounded in issues that emerge from the day-to-day engagement with patients and service users in the services to which they contribute. The research emerges from practice, is embedded in practice, and changes practice for the better. Having the dual focus, however, means they do not have to step away from clinical roles to pursue ideas that they know will ultimately make a difference to care and services. The tradition of clinical academics and nursing goes back a long way. Florence Nightingale is often seen as the very first nurse researcher. While working as a nurse during the Crimean War, she used systematic approaches to collect and analyze data to understand how mortality could be reduced in soldiers injured in wartime. And her research findings led to changes in the environment for sick people, including cleanliness, ventilation, water, and diet. In the UK, the clinical academic pathway for nurses, midwives and AHPs has been under development since around 2005. Recognising the value of supporting clinicians to do research in the area of their expertise and in response to historical barriers, the National Institute of Health Research and Health Education England have established national funding streams to provide career pathways for those committed to a clinical academic role. These pathways include a range of opportunities, including internships, master studentships, right through to senior postdoctoral clinical lectureships. Over the last few years, under the leadership of Professor Susan Kaur, who's our previous head of research and development, a considerable amount of foundation work has occurred, ensuring that LPT staff are aware of and supported to apply for funded stepping stone and capacity development opportunities to become clinical academics. As you can see from the slide, these include a significant number of awards, accounting for roughly 700k worth of CPD secured for a range of LPT staff. Apart from the regional and national opportunities listed on the slide, LPT has also created innovative opportunities specific to our organisation. These are the Research Envoy Scheme and the Clinical Research Associate Initiative in collaboration with De Montfort University. I'm personally very grateful for the support that I received over the last few years. I was fortunate enough to be awarded the Silver Scholar Award, which is a pre-doctoral scholarship, a Raising Health Charitable Funds PhD Award, and also a Clark East Midlands PhD studentship. And without the commitment to develop clinical academic careers in LPT and the support I received, I doubt if any of it would have been possible. LPT is committed to developing a culture where nurses and AHP consider the application of research to be a core component of their roles. It is therefore envisaged that all staff will engage with research in some way to benefit patient care, whether this is through using research findings to inform their practice, involvement in a research study, or leading their own programs of research. To further support our ambition to develop clinical academic opportunities, we are delighted to announce the Director of Nursing Fellowship Programme launching in autumn this year. Despite national funding streams to support distinct career pathways for those interested in clinical academic roles, there are limited opportunities for frontline staff to gain exposure to the realities of combining clinical demands and academic development. At trust level, we were presented with ongoing challenges on how best to identify, support and develop clinicians aspiring to or considering clinical academic roles outside of competitive national schemes, therefore emphasising the need for an in-house, locally driven foundation level scheme to support staff insight and skills development. Before I tell you a little bit more about the Director of Nursing Fellowship Programme, I would like to just start by giving a shout out to Professor Jo Cooper and her team in Nottingham University Hospitals. In response to a shortage of registered nursing staff in NUH, the original Chief Nurse Fellows Programme was conceptualised and designed by Jo Cooper and Joseph Manning to develop foundational clinical and academic skills in frontline junior staff. This initiative has been adopted across many organisations in the UK, and although organisations utilise the key principles of the original Chief Nurse Fellowship, many of the programmes differ in content and focus. We rebranded our programme as the Director of Nursing Fellowship to reflect Anne's title. The aim of the fellowship is to implement a bespoke programme designed to develop skills in leadership, innovation and improvement science for frontline junior clinical staff. The Director of Nursing Fellowship is aimed at 5 nurses who have completed their preceptorship. It will take place for a period of 1 year, of which the fellow will spend 1 day a week on fellowship activities and the rest of their working week in clinical practice. Our first cohort will consist of a total of 6 fellows, of which 2 will be there will be 2 allocated to each directorate. Each fellow will be supported by a clinical and academic mentor with monthly contact. A number of our lead nurses agreed to be clinical mentors, while the academic mentors will consist of LPT staff who have doctoral qualifications or are nearing the end of their doctoral studies. Fellows will have a quarterly meeting with Anne as the Director of Nursing, and the project findings will be disseminated through presentation, publication, newsletter and quarterly reports. We also intend to formally evaluate the programme through structured feedback and through case studies, and the fellowship will conclude with a celebration event on completion. The actual fellowship programme will consist of 2 key components. The first component is a development programme consisting of a taught element and shadow opportunities in leadership, research and quality improvement. And the second component is a quality improvement project. Now, for the leadership aspect, we have a bespoke programme designed by our organisational development team, and the core modules will include developing your own personal leadership style, motivating and inspiring excellent performance in others and teams, and developing self and others. All the fellows will also have the opportunity to undertake a Myers-Briggs assessment with individual and group feedback. From a research perspective, that will include introduction to basic research skills, different research methodology, critical appraisal of evidence, writing for publication, to name just a few. And then from a quality improvement perspective, Lynn Williams and her team will support the training and project delivery. QI training will include QI basics, coaching, measurement, life QI and project management. And fellows will have the opportunity to present their project at the annual QI conference. In addition to the taught element, fellows will also have a range of shadow or insight opportunities. For example, for the leadership component, they may attend a finance meeting or the lead nurse meeting, for example. And for the research, I'm hoping that they will be able to spend some time with research delivery staff or shadow a principal investigator. The quality improvement project, in terms of the project itself, it must be focused on an area pertinent to the fellows' area of clinical practice and be aligned to organisational objectives. Regular action learning sets will be utilised to explore and address their development needs and any work-related issues to improve their performance and effectiveness as leaders. And that is, in a nutshell, what the Director of Nursing Fellowship will involve. So in conclusion, I guess the bottom line is that clinical academic careers for clinical academic nurses and other AHPs have a vital role to play to improve patient care and outcomes. Although we've come a long way in terms of clinical academic development opportunities in LPT, we still have a lot more to do to embed clinical academic roles at all levels. I'm truly grateful for Anne's commitment to the ongoing development of clinical academic careers in LPT. Despite the challenging times we've been through, her interest to take this agenda forward through development of clinical academic career strategy and a clinical academic pathway for nurses and AHPs is appreciated. In addition, the Director of Nursing Fellowship Programme is a welcome addition to our existing clinical academic development office, and I think it's an exceptional opportunity for our Band 5 nurses. So taking all of this into account, I feel that the future for aspiring clinical academics in LPT is bright. Feel free to spread the word about the DON fellowships, and recruitment will start soon. Thank you. Happy to take questions.
Wow, thank you, Lizelle. That was absolutely fantastic. There's so much going on, isn't there? It's just full on, but really, really exciting. And I'm sort of thinking, gosh, I wish I was 25 years younger, really. Because when I started off, these sorts of opportunities just weren't there for people. So it's absolutely fantastic. Anne, I don't know if you wanted to come in to say anything, because obviously you've been very, you've inspired a lot of this work. I don't know if there's anything you wanted to add before we open up to questions.
Well, how proud I am, and I think I've just got to put a bit of a shout out to Claire and Lizelle. Claire Armitage is the Deputy Head of Nursing in the Directorate of Mental Health, and Lizelle for really taking what was a sort of a nugget of an idea that I brought with me from Nottingham Acute Trust when I had the pleasure of working with Joe Cooper and Dr. Joe Cooper and Dr. Joe Manning. In fact, Joe and I we studied together, so it's really great that we're seeing this come round, and we're plagiarising and pinching with pride some of the work that they've done, and it's just fantastic to see. So I look forward really to seeing the results of this work, and hopefully we will do it proud. I'm sure we will. So yeah, I'm very proud, and I'm looking forward to seeing how well we do. Claire.
Oh, it was just to say thank you,
Anne,
and my appreciation for working with yourself and Lizelle on this issue. It's really exciting, and great presentation, Lizelle, and I think you're quite right to say the future is bright in terms of clinical academic careers. It feels like we've got a real aspiration now in this trust, and we do have a role advertised at the moment as well for somebody to take a lead on this for a 1-year development opportunity to really put an excellent framework in place for a clinical academic career structure within LPT. And I think, Lizelle, your presentation showed how somebody can go from newly qualified nurse up to clinical academic level within LPT, and that's our aspiration, that LPT becomes an employer of choice really for somebody that does want to take their career down that route. So thank you for all the work that you've done.
Yeah, absolutely. I suppose the other thing I just want to mention, and I do say this in any of the talks I do around research, and most of you will know I do have a passion from a research perspective. I've studied myself at doctoral level, and proud to say that I achieved that. I also really value nurses who choose not to sort of take that study line. I think from an NHS perspective, we need both sorts of nurses to work with, and I have learned so much from unregistered nurses and an awful lot from registered nurses who have chosen not to do the sort of doctoral masters or degree route. So I just want to put that out there, because I think sometimes we can get a little bit tied up with really wanting academia throughout, and absolutely there is a case for that, and there's a need for ensuring that we've got academia and there's a place for it. But there is also a place for nurses who really just want to nurse and look after patients and don't want to go down the route of studying. And equally we need both sorts of nurses working in our organisation and looking after our patients.
That's a really good point, Anne. Thank you. Yes, we need a mix, don't we? That's what works best. Just looking at the comments, Lizelle, people are saying that they think your presentation is absolutely brilliant. And they can really see and feel your enthusiasm, and I think we're all enthusiastic about the work that you and Claire and others are doing. So thank you very much. So I'm going to move us on to the next presentation now, which takes this theme a bit further, really. So one of the things for me, Lizelle, that you said was about stepping out and seeing things from a different perspective. That undertaking research enables you to do that. So Pretty is one of our palliative care nurses who's decided to do just that. And she's going to talk to us about what it's like being a nurse undertaking research, and why this is a really important feature of the future of nursing. So over to Pretty. Thanks, Pretty.
Thank you, Margot. Thank you for having me on this forum, and happy International Nurses Day to everyone. My name is Pretty Mukungunugwa, and I'm a clinical academic nurse. And I am on a 2-year secondment as a clinical research nurse. I do 50% of my time researching and 50% of my time being clinical. I'm very passionate about end-of-life care, and I'm very passionate about giving the best care to everyone, despite their background, despite what they present with clinically. I'm passionate about giving the best care to everyone, which I think is every nurse's passion. The clinical secondment started in 2019, but because of the COVID, which disturbed everything, the program had to be put to a hold. And after 20, we had to restart it in 2020 in October. And now I'm on a 2-year secondment, which I'm hoping to achieve my objectives. To do this research, I've chosen a topic about end-of-life care for patients from the Black and Asian minority ethnic group. This is just one out of 8 group of patients who are experiencing a poor end-of-life care, according to the CQC report of 2016, a different ending. So when we came out of when we gradually came out of the pandemic, I noted this quotation, which is on the slide, which was on one of the newsletters on April 2021. It says, the past 12 months have been demanding indeed. And as the nation is gradually coming out of these restrictive measures, we can finally see the light. The last 4 words touched me, and I said, finally see the light. What made us see the light? And undoubtedly, research has made us see the light. And I don't think anybody will argue with that, because we have managed to get vaccinated. There is a large percentage of us which has managed to get vaccinated, and these vaccines came from research. We, the nurses, spend most of the time with the patient as compared to other professionals. So I think we should also get involved into research. Next slide, please. Next slide, Anita. So these are the reasons why, oh no, go back a little bit, please. Yeah, these are the reasons why I thought nurses should be involved in research. I've come up with 4 reasons why we should get involved in research. The first reason is to inquire. I've been inspired by one of the late nurse researchers called Lizbeth Hockey. She was an Australian-born, British-born researcher, and she was the first director of nursing research unit in Edinburgh. And she inspired me because she talked about nursing should inquire, should bring curiosity and analysis to nursing care. And I thought, yes, I'm a nurse, and I should also have some curiosity why such things are happening, what we can improve about our patient care. And that's why I've taken up research. The other reason for taking up research is to discover. We want to discover and build up on evidence-based care. We use evidence-based care, which has been researched by others. Like you're going to see in my next slide, there is a small percentage of nurses doing research in our trust. So we use research to discover the evidence which we can use to give the best care to our patients, and that's why we should get involved in research. Then third, we need to improve quality of care. As we add up a body of knowledge to what we already know, and as we share our experiences and adapt to working differently, we will improve care. Just imagine what would have happened when when COVID outbreak in 2020, and if we didn't have somebody who had researched on MS streams. How was the organization going to run? How were we going to conduct our meetings? How were we going to conduct clinical supervision? So we need researchers to identify those areas which we need to add an extra body of knowledge and improve whatever we're doing. And then also to involve staff. We need to engage the nursing community into research, like what my colleague Lizelle has said. There is that DON scheme now, which is trying to encourage everybody to everybody who is interested in research to get started into research programs which are available. By so doing, I think we will all be stepping up to grade and improving our care. Next slide, please. How can nurses get involved in research? Every week we've got a newsletter in LPT. And if you go through that newsletter, you find out there's maybe some questionnaires, some audits, some yearly staff surveys. That's the start of research. If you get involved into participating into doing those audits and completing those surveys, that improves the care. It's very important to not just to ignore the email or the newsletter, but to complete that survey, and let your voice be heard. We cannot be heard if we are just quiet and we just stay in a clinical role and not participate in audits. We should also participate in researching itself. As I said, I'm doing a research on end-of-life care, and I'm calling. I'll get this chance to call upon all nurses who look after end-of-life care patients to participate into my research as well. If interested, you can see me. You can email me later and get my details. Like Lizelle said, nurses in LPT, you can attend some research forums. Yesterday we had a very nice research forum, a good research forum about editing, teaching about not about editing, sorry, about publishing. It was how we can publish whatever we have written and let people know about our literature, about our views, about what we are doing. It was a good forum, and if people can attend such forums, which are advertised in our newsletters, I think that will improve their care or their mindset as well. Also, there are some schemes which Lizelle has mentioned, the research envoys, and also some clinical development opportunities, which my colleague Lizelle and Claire Armitage are in. I think there is a third one. And also, yes, there are three of them. I can't remember the third one, sorry. And also there are some research associates, clinical associates like myself. I don't know if the scheme is going to continue, but there are two clinical research associates, and I'm one of them, and there's one of them is an OT. And through participating in such, or through going into such roles, you develop your research skills and improve the clinical care. Next slide, please. That's on that slide. I've outlined how LPT is participating in research. There are 3 nurses out of 10 research envoys, and they are doing quite well, the research envoys. One of the research envoys is currently doing a research in treatment of diabetic foot ulcers, and she's a chief investigator there, and she's starting a PhD. And one of them is also doing a master's in research. 2 of them actually. 2 are doing masters in research. Then there is also 3 nurses out of 7 in research development opportunities. That is the likes of Claire and Lizelle. And there is also one nurse out of 8 clinical academic clinical researches, and that one nurse is myself. And out of all those 7 nurses, 2 of them are doing masters in research and 3 are doing PhD. If you see the proportion of nurses to other healthcare professionals, it's a little bit low according to my liking. And I am encouraging that as nurses, let us use the research as an engine to drive our progress forward and to step up to grade. Thank you. That's all I have for you. Thank you.
Thank you very much, Pretty. That's absolutely great. And that last paragraph about being an engine and driving that, I really like that. I think what's come across for me is your passion, and your passion is quite infectious actually. And since we've not known each other very long, but since I've met you, we've been doing a little bit more ferreting around in CHS to think about research opportunities. So you're having a very positive effect, certainly on my thinking. Are there any questions or comments for Pretty around her work? Lizelle?
Sorry, my chat function's not working. I just want to say well done, Pretty. It was a brilliant presentation.
Thank you.
Anne?
Oh, lovely. Thank you. Yeah, well done, Pretty. That was fantastic. So now I know where you are and I know your name. So nobody escapes. Anyone that's got passion like that does not escape me. So Lizelle and Claire, I will expect to see Pretty on the Shared Governance Council around creating clinical academic role, non-medical clinical academic roles. We're creating a strategy. Pretty, I want your name all over that, please. So there you go. Well done. Well volunteered as well. Fantastic.
Thanks, Anne. Claire?
Thanks, Margot. I was going to say similar to Anne, really. We talked a few minutes ago about the post, and Lizelle was saying how bright the future is looking, and you're very much part of this. So my question was really going to be for you, what thoughts do you have about how LPT can support nurses such as yourself? And I think as Anne said, as nurses, we've all got a responsibility for research. And for many nurses, that might be some of the things that you talked about, like supporting research, supporting colleagues and patients and carers to access studies, filling in surveys, all of those sorts of things, just becoming aware and looking at evidence. And there'll be a small number of nurses who will want to take it further, as you are doing and Lizelle has. And I just wondered if you'd got any thoughts about how LPT can support people such as yourself with this passion.
Just giving them an opportunity to get into research. And with regards to my team, it's mainly about giving them time, really, giving them time to do things, giving them time to attend, especially some research forums which do occur during clinical hours. Right now, I'm doing this presentation from my car after my visit. We are so busy and we hardly have time to attend these functions. And I think my colleagues want to attend, but creating that time really is very difficult. I don't know what we can do, because we are so passionate about being clinical, and we can also have that passion of being academic, but managing that time between the two is quite challenging, and has been quite challenging for myself. I don't know what can be done about it. Time.
So I think, Pretty, if you can have a conversation with Lizelle and Claire, because I think that's one of the key elephants in the room, if you like, around how are we going to create the space and the time for our staff to develop and maintain, academic qualifications, working towards them. There are many ways in which we can do it, but actually, you're absolutely right. What we don't want to do is affect the service and the delivery of care, of patient care. So we need to start having conversations, and we're going to fix this by having conversations and influencing appropriately. A really good question. Well landed.
Thanks. I'll be in touch.
Yeah, be in touch, Claire. Thank you.
Just to let you know, Pretty, the comments that are coming back in the chat, if you've not accessed them, are all really, really positive. Brilliant work, inspiring what you're doing. And colleague Dawn has said that you're passionate, and as many of nurses are, but coming away from the clinical work is difficult, and there is a real tension, isn't there, between doing that. And for me, can I just say a personal thank you for doing research in patients at end of life. So that's my background, and I think sometimes there's reticence because we think patients have got better things to spend their limited time on than undertaking research. But we also know that end of life patients can sometimes find some meaning to life through their contribution to research. So so it's really, really important. So thank you for what you're doing, Pretty.
Okay.
So I'm going to take us on now to Caroline. So just for me, I was very fortunate to go to the Chief Nursing Officer for England's summit last year, back in March, and it was a great opportunity. And one of the things that was spoken about there was around digitalisation and digitalisation in nursing. And I don't think we could have anticipated that 2 weeks later we'd be going into what we went into in terms of the pandemic, and we've already heard this week from Zoe Harris about virtual working and digitalisation, and Caroline's going to talk to us about why this is our future. So Caroline, over to you.
Brilliant, thank you, and thank you for having me today. Nice to see everybody. So yeah, we can move on to the next slide, please. So I'm a children's nurse by background, and I've worked in both the acute and community setting for a while, and digital healthcare kind of got into this sphere and field of healthcare without really realising I was doing it, going down this path, but absolutely it's the way forward, and the COVID pandemic, as Margot said, has really accelerated things. We want healthcare to be sort of easily accessible, and a great way to do that is by sort of creating a digital front door and enabling digital access. We want to encourage our service users to have some ownership of their health, and long gone should be the days of where we, parent the parents and, do that sort of thing. We need to encourage and empower our service users, and should be doing that more so. So we really want to encourage that self-care and ownership. But equally, we need to be kind of aware that we need to do it in a really efficient and effective way, because we have limited capacity. We've just talked about time and nurses stepping away from sort of clinical activities, and actually we don't want to add to people's workloads. We want to enhance and improve things for people. I think the important thing to say about sort of digital healthcare is that it should be a blended approach. At no point as a nurse particularly am I ever going to say that it is better than a face-to-face contact, but it's about offering service users choice, reaching out to those service users that maybe won't contact us in those traditional face-to-face ways, and actually around the efficiency and efficacy, it's kind of the making sure that those contacts that we do deliver face-to-face are for those people that need them, and that they're good quality. So this is a quote from the NHS long-term plan, and digital is absolutely littered throughout that document. And as we've said, COVID has accelerated the kind of digital arena. So it's about creating straightforward digital access, as I've said. The system that we work in as healthcare professionals is complex enough, let alone how complex it is for our service users. So we need to simplify things, and digital is a great way to enable us to do that. Okay, next slide, please. So as I said, I kind of went down the this digital nurse pathway and area of work. And what motivates me, it's not, you know, digital is not something that inspires everybody, but, you know, that's the beauty of nursing, isn't it? And the opportunities, and that we all like different things, and different things get us out of bed in the morning, and the passion. But actually the scale of impact that I can see that digital healthcare can have is massive, and the outcomes that it can have. This is a feedback quote from a service user, and that is what motivates me, knowing that what I do and the services that I lead can have such a massive impact for people. So some people will say, you know, you're a proper nurse and all that sort of thing, you work in digital, but absolutely, you know, it's just a different way of delivering healthcare, but it has such an impact. So that's what motivates me. But really as well, the thing about inspiring service users and empowering them to take ownership of their health, we need to create a strong future generations and enable people to, you know, support themselves. And so if we can give them good tools, you know, they've got lots and lots of different digital platforms that they can access, but we need to make sure the ones that we're giving them are NHS assured, they're evidence-based, and they're quality, because there is so much out there that unfortunately isn't. But also the impact that I can see in, and kind of again what motivates me around supporting services. So again, I don't think digital should be a nice to have, or it should be you know, when it's seen as that, oh, that would be nice to do that, but it's not really part of our core offer or things like that, it doesn't work. It doesn't kind of get embedded. It doesn't, you know, service users don't engage with it because the staff haven't engaged with it. So it's how I can support services to really kind of embed something that is going to be a success and that helps them and their service users. And as the clinical lead for the digital development team in LPT, a lot of my role is around that, ensuring that what is delivered via digital platforms is quality. And that could be from the way that the practitioners and the services use the information through to how they're supported in safeguarding situations and things like that. Because I think there's lots of different tools out there that you can implement, but then it provides a great service for the service users, but does it really support the practitioners in their capacity, but also if they really needed help and support, what would they do? How do they manage this? So we really need that wraparound sort of support from for the service user and the professional. Okay, next slide, please. So the future in digital. So I'm really excited, and I think the COVID pandemic we've got to take some learnings, haven't we? And we've got to take things that, you know, have improved because of it. We've got to learn. And I think seeing the enthusiasm and the interest in digital in healthcare is really, really just kind of inspiring me even more, because I'm now creating a bit of a network of people nationally that are involved in digital. We're learning again from each other of what practices we're doing in each organisation, because we don't want to reinvent the wheel. Let's, you know, share good practice. So it's a really exciting journey to be on, and the appetite is there from the teams as well as the service users. So the service users are so open to sort of digital now and actually engaging in digital ways, and probably find it, you know, actually it's really quite easy in terms of more convenient for them potentially and things like that. And also the teams are sort of, yeah, we've got to get on board with this, we've got to improve what we're delivering, and we've got to be as efficient as possible. So there's really been a shift in that sort of, I felt probably as a nurse working in digital pre-COVID, a little bit isolated, maybe a little bit sort of on my own, and kind of, you know, there weren't many people out there that I was connected to this massive shift and this whole community of people that have that I can now reach out to and connect to. And I think it's about the art of the possible. So as you know, found that quote from Florence Nightingale that, you know, nursing is a progressive art, such that to stand still is to go backwards. So we need to move with the times. Digital can be scary for some practitioners, and I think we need to acknowledge that, and not everybody has the same level of digital literacy, and I think again we need to acknowledge that. And I know that I'm a lot further on in my sort of journey in embracing digital than a lot of professionals will be. But it's how we can really, you know, Pretty and Lizelle have talked about the enthusiasm that people have got working in sort of clinical areas and clinical practice, and how we can get that experience, that enthusiasm, and support people to introduce new ways of working. But I think the key is the engagement and support element of it. And I think if we can support and engage people, then actually nurses have got a really good can-do attitude, and we'll just get on with it, won't we? And actually, it might be a bit uncomfortable. There might be a few grumblings about things, and, you know, we'll be a bit grumpy about things sometimes. But as long as we can support, you know, show support and support each other, then actually we'll just get on the bus and we'll go with it. And I think that's why I think nurses are absolutely well placed and you know, intrinsic to how we move healthcare forward. And that can be anything through to, you know, monitoring at home, through to, you know, access to services, anything. I think nurses really make me feel that they're the workforce to do this. So thank you for listening. And if anyone's got any questions about sort of any digital innovations and or how they can kind of link in with what we're doing as a team, then please do reach out and get in touch. Absolutely.
Thanks so much, Caroline. Really interesting what's going on, and it's absolutely the way forward. We're not going backwards, are we? We can't do that. One of the things that I was going to say, but you answered the question really, is that do you think people are scared of digitalisation? But I think it's about having the support, isn't it, and being given the right equipment to use and being taught how to use it, and making sure that we've got confidence in using it.
Yeah, absolutely. And it's that acknowledgement that it's not a replacement of face-to-face care, because I think some people can feel threatened by it and sort of think, you know, will there be a need for me in my role if we implement digital? But I think it's about actually the blended approach, as I've said, but and recognising that it is scary and recognising that it's uncomfortable, new ways of working, challenges, change, you know, it all comes together. But actually that it's not going to ever replace that quality face-to-face care that you can give, but you can't give that to everybody, and not everybody needs it. And I think that's the thing. It's service user choice, but also dependent on need, isn't it?
Yeah, I think there's also something about not making assumptions. I think sometimes we think that it's only young people that want to engage with digitalisation and can cope with it, whereas actually that's not necessarily true. And it's about using this technology with the right people, isn't it?
Yeah, absolutely. From a service use perspective, absolutely. And you know, from sort of a practitioner's perspective, from a, you know, clinician's perspective, I've seen so many people and been met with, you know, quite sort of people with their barriers up and saying like, I won't be able to do this, I'm rubbish at technology, I can't do this, I'm technophobe, you know, I struggle to send an email, etc., or whatever. And actually it's about, okay, we see that, but then let's support you to deliver it safely, let's support you to help you use the tool, but you've got so much experience and knowledge, that's what we want. It's just delivering it in a different way and not forgetting the, you know, or, you know, making them feel empowered that they've got so much experience and knowledge that that's what we want. It's just a different way to deliver it.
Thanks, Caroline. Anne's got her hand up.
Yeah, thank you. It's more a comment really. Thank you very much, Caroline. We've had a chat, haven't we? And I know you've come to lead nurses, so we absolutely need to embrace you know, what more about digitalisation. And I remember, I mean, this is to show my age now, but I remember working at the Leicester General years and years ago, and the concept of the electronic blood pressure machines was introduced to us, and we were all up in arms about it. Oh no, we got, can't possibly, we haven't got time for that. And actually, even just as something as simple as that, where it took the pulse rate and the blood pressure all at the same time, it was just like, oh, this is fantastic. We embraced it after we realised. But I think it's about fear of change, isn't it? And it's that's the issue that we need to make sure that we need to make sure that nurses feel comfortable and confident to embrace that change with the right training and the right platform, that so they feel able to grasp it. And also I think there's a fear of gaps. So when we're transitioning from one platform to another, we do need to be careful that stuff doesn't get sort of fallen through the gaps. And I think that's one of the challenges that we have. But well done, thank you.
Thanks.
Yeah, thanks, Caroline. There's lots of positive comments in the chat, Caroline, if you're able to access them. People generally, agreeing that digitalisation saves money, saves time, is really positive. Tracy's talked about some work around a wound care app that she's looking at. So there's stuff going on. So please, I'd encourage colleagues to link with you and vice versa to take this agenda forward. So I'm mindful of time, so I want to hand over to Anne now for her closing comments. Thanks, Anne.
Oh, thanks, Margot. Right, well, gosh, where to start? It's been a great week, and we've heard some fantastic stories. I've just captured a couple of words really from the week of webinars, and also I've had the fortunate experience I've gone out and about all week. I've been across adult and children mental health units. I've been to the Agnes unit. I've been to a couple of the community hospitals, and I've chatted to patients, and I've chatted to our nurses. I've heard some fantastic stories of achievement. I've heard some fantastic honesty. I think the words that come to mind for me are how we are stepping up to great. Absolutely stepping up to great, stepping up to delivering great patient care that's compassionate, patient care that's curious, that's research evidence-based, patient care that's quality, actually making a real difference to patients' lives. I've heard from patients who have really recovered, actually, and the nursing impact has helped them to recover through their care plan. I've heard from patients who are being helped to enable on discharge so that their lives they will be able to live a quality of life. And I think, we need to remember the key, really great achievements that we do every single day. Okay, these are not big stories. These are the impact that we have on patients' lives every single day. And so I want you to reflect on that, because this is really key. Pretty's talked about hope, and hope is absolutely, something, particularly in the unprecedented time that we're in at the moment. Hope is a really excellent word. The engine to drive passion. I think Pretty, you said that. Absolutely, for me, that is what nurses do. The engine to drive good quality patient care. Let the nurse's voice be heard. You've said that, Pretty. I've heard that a few times this week. Let those voices be heard. Yeah, really key. We need to have a voice. We need to make sure that we're supporting each other. I think, being really clear about our own well-being and looking after ourselves, but really looking after each other so that we can then look after the patient. Yeah, so I think it's been a fantastic week. It's one where I've felt the kindness coming through. Kindness to ourselves, kindness to our patients, absolutely fantastic. I'm very, very proud to say that I am your Director of Nursing. Absolutely, I'm so proud. So I'm going to get emotional now, so I'm going to be quiet and shut up. Otherwise, you're going to see me in a bit of a blubbering mess. But thank you all so much for all you do every single day.
Thanks, Anne. Thanks everybody for participating. It's been really great. It's been a joy to be involved, and a big thank you to Anita for all her help. And here's to another great year of the nurse.